Really excited to have Dr. Gary Kaplan on the podcast with us today. Gary is a clinical associate professor at Georgetown University School of Medicine and founder and medical director of the Kaplan Center for Integrative Medicine. Dr. Kaplan's a pioneer and leader in the field of integrative medicine and is one of only 19 physicians in the country to be board certified in both family medicine and pain medicine. He's the author of Why You Are Still Sick, How Infections Can Break Your Immune System and How You Can Recover. And in November, he's going to be co-chairing an international conference on new developments in understanding chronic illness. More information on that conference in the podcast. We go over inflammation, the causes, the background, ways to live a low inflammatory lifestyle, and just a small trigger warning, we do discuss neuroinflammation and some of the psychiatric implications of neuroinflammation in specific case studies. So if that kind of content might be troublesome or disturbing for you, listeners, beware. But let's jump in and a great conversation with Dr. Gary Kaplan. Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing. All right. So excited to have Dr. Gary Kaplan. Gary, thanks for joining us today. As people heard from your introduction, really just an incredible career and a pioneer in the field of integrative medicine and, whole patient care. So we're really excited to have you on with us.
I am delighted to be here and thank you for the introduction. Very generous.
Fantastic. Well, listen, let's jump right in. One of the more popular topics that we've chatted about in the past on the podcast has to do with chronic inflammation. And we all know, acute inflammation is really important and valuable, helps us fight off infections, helps us respond to training and allostatic loads and adapt and just get stronger. And that's great. But that chronic inflammation really is tied to, associated with, causative for so many of the diseases of Western society, from diabetes to cognitive decline to cardiovascular disease, cancer, etc. So we've got some time together. You're an expert on this. I'd love to hear your perspective on ways to live an anti-inflammatory lifestyle, how to tell if that's if chronic inflammation is really part of what's going on with some of your symptoms. And I'm going to keep it broad, and let's just start there and see where it takes us.
Perfect. Actually, where I want to start is what's inflammation? Because we talk about inflammation, and inflammation is so many different things in the body. It's not a thing. So that if you have allergies, right, your nose is all stuffy, your eyes are running, that's inflammation mediated by a particular part of the immune system, the IgG, the mast cells, and that's a result of things that are that you're allergic to in the environment. Okay?
Sure.
So the way you want to treat that is with an antihistamine, perhaps, to get rid of the symptoms, or you want to do immunotherapy in order to desensitize yourself to the ragweed or the pollen or whatever. That's one type of inflammation. Another type of inflammation is you skin your knee. The knee gets all swollen and pussy. What's happened there is that it's a bacterial inflammation that's occurred there, mediated mostly by white cells. And so there the treatment is an antibiotic. That antibiotic's not going to help you as far as treating your stuffy nose and itchy eyes, but it will help in terms of killing the bacteria. So when we think about inflammation, we want to think about root causes of inflammation, and we want to think about what's driving the inflammation. And in chronic illness, basically we come down to two great big pieces of the immune system. So we come to the innate immune system. Okay, that's our first responders. These guys kind of kick out as soon as any injury happens to the body. And what can happen on the innate side is that it can get stuck in overdrive and stay there. All right, in the brain, those fall into category of three different cells: microglia, mast cells, and astrocytes. Those are useful to know because now what's your target? So if you want to target microglia, as you're doing your research, you're going, okay, what affects and impacts microglia? If you're doing things in terms of mast cell activity disorder, okay, what are the things that you can use to stabilize mast cells? So you're thinking about this. Astrocytes are off to the side at the moment because we're not quite sure what to do with them. In the peripheral, we're looking predominantly at white cells in one form or another. And in post-COVID, for instance, one of the things we think has gone wrong is there are three types of white cells, or three types of monocytes. Specifically, the non-classical monocytes, we think, is continuing ongoing activity and kicking out inflammatory particles. These are cytokines. And so what we want to do is target that and help that shut down. Okay? We're getting a bit technical here, but I'll back out of it in a minute. The other side of the universe is the acquired side. That is, we give you an immunization, you build antibodies to something, and you fight off the infection. All right? So what happens on the acquired side is fine if you ramp up and ramp down. It's not so fine if the acquired side, where you're making antibodies, suddenly goes, you know what? Yeah, you got Lyme disease, and we're fighting Lyme disease, but your brain tissue looks a lot like the bug. The proteins are similar. So we're going to attack the brain. Not so good. And so now we have this problem, and certainly we see this in the PANDAS kids, this acute onset neuropsychiatric syndrome, and these poor kids are abused to the nth degree because the medical system gaslights them, tells the parents that no, they're not seeing what they're seeing. These kids are not having true seizures, they have pseudo seizures, they're not having these behavioral disorders. We're going to medicate them into oblivion so that they're not a problem to you anymore. But in the meantime, the kid has gone undiagnosed, untreated, and has a really crummy life as a result. And so we see this in ME/CSF, so myalgic encephalomyelitis chronic fatigue syndrome. We see this in chronic pain syndromes. We see this in non-responsive depressions and anxiety disorders. We get a lot of people that we see post-COVID where all of a sudden they've got this onset of panic attacks and anxiety disorders they never had before. Mm-hmm. All of this is a result of inflammation going on. So what you're looking at with all of these symptoms, chronic pain, chronic fatigue, brain fog, focus and concentration issues, problems with sleep disorders, all of this stuff is symptoms of inflammation in the brain. And then it's a question of how you balance that out. Now, so we back out to the 50,000 foot view, and what are these simple things to do, the direct things you can do in terms of managing the inflammation? Well, exercise, pure and simple, right? Exercise is one of the best anti-inflammatories for the central nervous system, and we know that a combination of both aerobic and anaerobic exercise is what's necessary to really get the best possible results. However, if you have chronic fatigue syndrome, that ain't going to work for you because you're going to crash. All right? Mm-hmm. So you have to be careful about your energy expenditure in what you're doing. You want to exercise as much as you can, but we don't want you crashing because crashes cause equal inflammation. So exercise. For the rest of us, do what we can do and do it on a regular basis. 3 times a week is kind of baseline and the most productive. Sleep. Sleep is something we're willing to sacrifice and should never, ever sacrifice, right? So getting 7-8 hours of sleep, unless you're a teenager, in which case they should be getting 9.5 hours of sleep. And how many teenagers are doing that? And why do we sleep? So you have to think about that for a second. So when you sleep, what happens is there's different stages of sleep. So sleep isn't a thing. It's stages 2, 3, 4 in REM. 3, 4 we generally consider slow wave sleep. And if I put you into a sleep lab and I wake you up every time you go into stage 3, 4 sleep as measured by the EEG, inside of a week you will have generalized pain. So sleep is really critical in order to be able to control pain. So when we talk about sleep, a couple of things we want to pay attention to also. Do you snore? Do you wake up refreshed? How long does it take you to fall asleep? How many times a night are you waking up? One of the things all of your listeners can do is take the Epworth, EPWRTH, available online, just Google it in, and it's a quick scale. Do you fall asleep when sitting in meetings? Do you fall asleep when driving in the car? It goes through a very short list, and inside of a minute, if you're scoring 9 or above on that, you need to be evaluated for sleep apnea. Mm-hmm. Sleep apnea affects 5% of the population. 85% of that population is not diagnosed. Failure to diagnose sleep apnea will take 10 years off your life. It's a chronic inflammatory condition in the central nervous and in the cardiac system. So it's going to raise the inflammatory markers that you see in the periphery as well, and that may be sedimentation rate or C-reactive protein. So it's a big cardiac risk. It's a big stroke risk. and it's going to make you feel miserable. You won't have the energy to do it. So sleep, and thinking about the pathologies that we may see with sleep. If you're tired all the time, one of the things that should be done is a sleep study. And that can be done. There's a home sleep study that can be done. There's a device called a WatchPat, which is an FDA-approved device. You have to get it through a physician. But the WatchPat, easy to do it at home, overnight study. Everything gets downloaded onto the net and it gets read. And first pass to determine if you have sleep apnea. But the other thing that we see with people with daytime hypersomnolence is a condition called narcolepsy, frequently missed. Okay, so narcolepsy, people think about, I start laughing, I have a strong emotion, I collapse. All right, that does happen, and that's one type of narcolepsy without question. But the other type is simply tired all the time during the day. And the only way you can know about that is do sleep studies. So doing sleep studies are really important, factoring that into your thought process and making sure you're getting adequate sleep. By the way, the sleep medications, such as Ambien and those things, actually screw up your sleep cycles. So it's not just enough to get 8 hours of sleep. You have to get 8 hours of sleep with the proper patterns going through the sleep cycle with stages 2, 3, 4 REM. So we want to make sure we're preserving that, and the best way to do that is natural sleep, obviously. Meditation is also a good anti-inflammatory in the central nervous system and for the body in general. So that would be number 3, doing things like meditation. Meditation, 10 to 20 minutes a day, every day, is what I would recommend. For myself, I do about 40 minutes of meditation every day. So I think that's an extremely important thing to help re-regulate and balance the system and dramatically reduce your inflammatory markers. I think that the other major thing is diet. Not telling you guys things you don't know about, but you may be eating a lot of foods that you have no business eating. And so one of the ways you can do that is simply put yourself on a hypoallergenic diet. Rice, fish, chicken, fresh fruits, vegetables, all organic. Simple as that. Do that for 1 month, and it's a challenge. So those are the big things that all of us can do immediately in terms of doing that. I think as part of everybody's physical, vitamin D levels need to be checked every year, if not twice a year. There's a huge percentage of people who have low vitamin D levels. Low vitamin D levels, anything below 30 nanograms per deciliter, okay, on the test, except that ideal vitamin D levels are probably in a 50 to 80 range. And so we need to have that. We need to make sure we're pushing that up because your immune system can't function normally if you don't have normal vitamin D levels. Yeah. Omega-3s, making sure that that's an important part of our diet. If you're going to take omega-3s, and I put most of my chronic patients on this, 1.5 grams a day of omega-3 fatty acids, and get it from a good distributor that makes sure that they've removed all heavy metals and any other toxins. So omega-3s becomes a very important part of keeping yourself healthy. So those are the big kind of overview things. If we want to refine it a little bit, one of the things that we can use in terms of medications is a thing like low-dose naltrexone. I don't know if you're familiar with that, but naltrexone is used for treatment of opioid overdoses, and it's also now being used to help addicts stay off, reduce the cravings for them, but it also is being used for alcoholics and help them reduce cravings and keep them off it. But very low doses, somewhere in the vicinity of 1.25 to 4.5 milligram, what they do is they down-regulate the microglia in the central nervous system, which reduces inflammation. Okay, and what does long-term inflammation in the central nervous system lead to? Parkinson's disease, multiple sclerosis, amyotrophic lateral sclerosis, Alzheimer's.
Yep.
So doing this stuff on a daily basis is how you keep yourself fit going into the future. Another medication that's probably going to pan out nicely for the anti-aging crew is metformin. Metformin is a medication designed for the treatment of diabetes, but it is an mTOR. So what that does is it modulates, not turns off, but modulates the activity of the acquired immune system so that it doesn't overreact. And indeed, what we saw with COVID in diabetics who were on metformin, they had shorter hospitalizations and higher percentage of recovery rates from COVID than the diabetics who were not on metformin. So metformin proves itself to be very useful in terms of treatment. And in fact, there's some suggestions that metformin may be useful as a first-line treatment for COVID. But I think it helps us overall to keep us healthy and keep the immune system from overreacting. The other supplement that's very good is NMN, which is used for treatment of mitochondrial function. And so that as a supplement, 500 to 1,000 milligrams a day, can be extremely effective in terms of helping keep your mitochondrial going, which are the powerhouses of the cell, and you want to continually replenish those and support those.
Yeah. So let me jump in and put an exclamation point on a couple of things and ask you some questions, maybe even push back a little on a couple of things. So the listeners are going to be really familiar with us just telling you to exercise so much. I mean, it's really the best medicine. The importance of sleep, the fact that we're activating our lymphatics at night and clearing out all the toxins from our CSF. I think an exclamation point on a sleep study. I can't tell you how many patients tell me they have difficulty with sleep, or they're just kind of tired during the day, no history of snoring, no history of sleep apnea, and you get them a sleep study and they've got moderate sleep apnea or worse. And it really is, it seems like the rule rather than the exception that that's going undiagnosed. So 100% if sleep is an issue for you or daytime somnolence is an issue for you, definitely talk to your doctor about a sleep study. I think in the old days it was, when you and I were in med school or fresh out or even a few years out, you had to go to a sleep lab. It was a huge pain in the butt. There's lots of at-home solutions these days to be able to get those done. Totally agree with the, from a food sensitivity standpoint, essentially an elimination low inflammatory diet is going to be better than any of the direct-to-consumer food sensitivity testing that you get done. It's really going to be where the rubber meets the road for you is try it and see what happens, and then you can reintroduce foods and see if there's an issue with particular foods. Omegas, 100% agree. Metformin, I want to agree. I want to see the TAME trial, and we don't have long-term human data to suggest that metformin extends health span or lifespan yet. I think we may have that, and definitely the effect, the anti-inflammatory effects of metformin. I mean, it's so interesting that some of the most popular medications in the United States are really are known for their treatment of specific conditions, but they're also strongly anti-inflammatory. So metformins, statins, right? I mean, there's definitely a strong anti-inflammatory component there. And then NMN and NAD plus and NR. I know we've got some data that NMN will raise serum NAD levels, but we don't really have any data that it's going to raise intracellular NAD levels. And again, not saying that this won't pan out to be true, so this is why I kind of hedged about pushing back. I'm not really pushing back as much as I'm saying, we have really strong evidence that exercise is neuroprotective. We do not have really strong evidence that NAD precursors or IV NAD is going to extend your lifespan. We think that physiologically it makes sense, right? But we just don't have that data yet.
I wouldn't disagree with you. I wouldn't disagree with you, Eric. But the issue becomes benefit risk, right?
Sure.
So what's the downside? The downside is the cost.
Yep.
The downside is needing to take the pills every day. But the side effects, pretty much minuscule.
Yeah, I think for metformin, you're talking about a slight blunting of the benefits of an exercise stimulus in folks who are on metformin. So if you're number one, you're 35 years old and your number one goal is to improve your body composition and drop your body fat by 3%, metformin might slow that down a little bit, and the risk benefit of that versus extending your life is something to consider. Certainly metformin can cause GI upset. That's generally pretty mild and nothing serious. And then, the NR, like some animal studies looking at NAD precursors and increased growth of neoplasm in animal models that already had cancer. No signs that it causes cancer in animals or in humans. And then, I think ultimately for NMN, it's just the cost, right? It's not cheap, right? I mean, NMN supplements can be pretty expensive.
You need a good supplement. You're absolutely correct. And in fact, there are studies going on now that are trying to create a pharmaceutical agent that'll be NMM. I'm more bullish on NMM these days because I've been privy to some early work going on with the military with NMM, and it's looking pretty damn impressive.
Yeah.
In terms of increasing strength, healing time, energy on these guys. So
Amazing.
stay tuned. The data's coming. You're absolutely correct. But an NMN at least, it's looking increasingly exciting from what I've been able to see. There are studies that are not yet in print, but coming that, why not?
Yeah, super excited to see that, and listeners are going to be familiar with me saying this. I reserve the right to completely change my opinion when a new study comes out.
And I will join you on that. Wholeheartedly join you on that. You know, the anti-aging stuff is such a treacherous minefield, right?
It really
because what we're recommending today, we may turn around tomorrow and go, don't do that. Yeah. And so we're trying to feel our way through it. At the same time, how long do you want to wait before you put something in place? Because the sooner you put it in place, the higher the probability to see benefit from it.
Yeah.
So everything's benefit risk, and you're right, you're a bit guinea pigging on some of this stuff, and the biohacking into the universe, as Dave Asprey would say.
Yep.
And be aware that that's what you're doing. But again, low risk, potentially high benefit.
Yeah.
I take it.
And I think with the the traditional problem with studying longevity is it really takes a long time to do a longevity study in humans, right? I think with the advent of biological age testing and methylation testing for DNA, hopefully we're going to see a lot more studies on the course of 6 months to 2 years that show improvement in DNA aging, and then we can extrapolate that at least into the effects we would anticipate on health span and longevity. So hopefully this is going to be something we look back on and we joke about how in 2023 we didn't really have much data on longevity, but in 2028 we're going to know a lot more. So we'll see what happens.
I think with the changes coming down the pike, 10 years, they're going to think we were throwing sticks at people to make them better.
Yeah, I think that's probably true.
Yeah. And so I'm reminded of the one Star Trek episode where they go back in time and Bones is walking down the hall in a hospital and this woman's calling after him and she's going for surgery and he says, "My God, they're barbarians." And he waves his little tricorder over her and the next thing you know, she's walking out of the hospital all cured, no surgery.
Yeah. I mean, it does happen. It feels like 15 to 20 years is kind of the historic span of looking back at something and saying that was ridiculous that we used to do that. And it does feel like, along with like Moore's law and everything else, this is just going to get shorter and shorter as our abilities and technology improve. That especially not to go down the rabbit hole of health. Of AI and healthcare, but I do think we're going to see breakthroughs at an accelerated pace over the next 5 to 10 years, more than we have in the past, for sure.
Absolutely, positively. One of the things about AIs is they can crunch data sets we can't even conceive of. And so they can look at genomics, and they can look at epigenomics, and they can look at metabolomics and proteomics. And we're going to be able to, as we get sophisticated with that data, we're going to be able to truly individualize medical care. We're going to be able to say, this supplement, this medication, this diet is ideal for you based on real-time data, as opposed to best guesses for what we're doing now. That's going to be within 10 years.
Yeah, and we're, proud to say we're in the early stages leading some of that work at Wild Health. So it's just excited to see what the future is going to hold. One of the things that I just wanted to make sure that we covered before I let you go back to probably a day full of more meetings, but I know your time's valuable. I appreciate it. I love your approach to talking to patients, at least what I've seen. I haven't been your patient, but what I've seen online around you're not crazy. There's actually likely something wrong that we can find and we can investigate. And I think that this is something that people with not easy to diagnose chronic conditions face all the time, is someone telling them, typically a healthcare provider telling them this is in your head and you just need to do X, Y, Z and everything's going to get better. I would love to hear just sort of, how do you frame that conversation with someone who comes to you and has a ton of vague symptoms? You don't really have a clear sense of what's going on just based on the interview itself. But how do you sort of affirm that and come up with a plan and strategy, not specifically what tests you would do, because that would differ patient to patient, but sort of would love to get in your head about your approach to that.
So I think the first thing is to believe patients. So when they come to you and they tell you they're sick, and I very carefully and thoroughly, my intakes are about 2 hours, so I very carefully and thoroughly go through everything going on with them. And interestingly enough, one of the first things patients do when I ask them the question, when was the last time you were in excellent health? The first thing they almost all do is lie. Pleasant people. They say, I was in great health until 2020 when I got COVID, and I've been sick ever since. And so that's fine, but we continue on the history. Well, the history shows that they haven't been sleeping well for years. The history shows that they started having migraines when they were 12. The history, you go on and on and on, and when they were really sick as a kid, they had multiple infections, and now you're getting a much bigger picture. So the answer to the question of why are the labs normal, the labs are normal is because we didn't do the right test, not because you're faking. And sometimes we don't know enough which test to do because we're not there yet. But if I go back to my research and I look at what's going on in the brains of people who are chronically depressed or chronically anxious or bipolar disease, they're all neuroinflammatory. They are all neuroinflammatory. And so since we back up from that, I'll give you an example of one kid who came in to see me, 17 years old. He tried to hang himself, multiple psychiatric hospitalizations, very depressed. I stepped back and worked him up from a neuroinflammatory perspective. This kid had celiac disease. 5% of celiacs, that is autoimmune disease to gluten, 5% of celiacs will present with only neurologic symptoms. And so this kid, severe celiac disease, we got him off all gluten, cleaned up his diet, we helped seal the gut. A year later, he is off all antidepressants and has had no reoccurrence. I've followed him for now 6-7 years.
Amazing.
So he's been 100%. So if you don't ask the right questions, you don't get the right answers. So you have to think in terms of, get a sense of the history of the individual and how they've gotten to this place, and understand that you're looking at people putting up with lots of stuff until they hit this break point and they go, okay, now they've collapsed. But in fact, there was a long story before it. Figure that out and figure out what's going on. Another thing that we see a lot of is mold toxicity. So there are people who get exposed to mold. Not everybody. About 80% of the population has the enzymes necessary to process the toxins that are in molds. And they can be in the same environment and not have any problem at all. But 20% don't. And those people can get very, very, very sick. I had one kid who was so sick that severe chronic fatigue. His problem was mold toxicity. And when we started off with him, now the brain is the most metabolically active organ in the body. Okay? What does that mean? How many calories does the average chess master burn in a 4-hour tournament? You know the answer to that?
I definitely don't know the answer to that, but hold on. 4 hours, chess master, so there's really no physical activity outside of resting metabolic rate and pressing that little thing that they press to the timer. I'm going to just guess to be fun that they're burning 600 calories above resting metabolic, 1,000 calories.
4,000 to 5,000.
Dang,
calories.
I knew I was going to be low, but I was going Price is Right rules.
Fair enough. Fair enough. That's an astonishing. I learned that from a patient of mine whose son is a chess master.
Wow.
They feed them all the time during the tournaments, and when I looked it up to actually, trust but verify, sure enough, that's what they're burning. So when people are talking about not being able to read, not being able to focus and concentrate because they're having trouble, that's probably a sign of inflammation in their brain. And then the question is why? Again, you don't ask the right questions, you don't get the right answers. But, if your blood count's fine, your thyroid's, and, all the other stuff comes back completely fine, we didn't ask the right question. So it's about believing people and saying, okay, I need to dig deeper. I need to see whether or not there's problems with your gut microbiome. I need to see whether or not there's problems with toxicities in you. I need to see whether or not there's an infection that was missed. All right, I have one young lady, started off when she was 10 years old, very sick, multiple infections. And then she develops OCD, obsessive compulsive disorder. She starts cutting. She ends up hospitalized, multiple psychiatric workups. She stabilizes, she gets out again, she starts cutting again, suicidal, inpatient hospitalization. She's now 16 years old. So now they send her to me and they say, well, what we're doing is working non-responsive. She had Lyme disease. She had CDC positive Lyme disease, and when we tested for antibodies in the central nervous system, she had autoimmune encephalopathy of infectious etiology. Very fancy name. It's also called PANS, Pediatric Acute Onset Neuropsychiatric Syndrome. And what had happened was the Lyme disease had tripped off an autoimmune reaction that started to attack her brain. All right, this kid for 6 years, what do you think the self-esteem is of a 16-year-old young woman who's been told she's crazy for the last 6 years of her life? She's been institutionalized on several occasions, and they missed the diagnosis. This child is not crazy. This child has been sick, and she wasn't properly treated. We need to step back and make sure we're asking the right questions and make sure we're doing the right tests to get the answers we need to help these individuals. And, post-COVID is the blessing in disguise. The blessing in disguise is people with MACSF were kind of written off forever. I served on the advisory committee of Health and Human Services for 4 years on MACSF, and the stories we heard over and over again from people were just absolutely tragic, how they'd been gaslit by the profession, dismissed, and told they were faking. And these people were horribly disabled as a result of these conditions. Well, COVID comes along, and the next thing you know, we have a whole new cohort of people who are suffering with chronic fatigue syndrome. Guess what? We now believe it.
Yep.
So now what's happened is we're seeing the research dollars go into the studying we need to do in order to find out what's going on, but it's a whole new perspective. So one of the other things I want your viewers to know about is this conference we host, New Developments in Understanding Chronic Illness. This is in conjunction with MedStar Georgetown. And this conference will be available to the public online, but also available in person for physicians and researchers. We had over 900 people at the conference last year, and it brings together some of the best and brightest people in the clinical and research arena to talk about these inflammatory diseases going on in the brain that affect about 20-30 million people. And so our faculty is from NIH, from Stanford, from Georgetown, from Columbia, and we're talking about this intersection of all these symptoms of fatigue and depression and anxiety disorders and how they're relating to brain inflammation and how the brain is getting to be inflamed and what we can do to back out of it and treat it.
Yeah.
So we have to think differently about this inflammatory stuff, and now you're thinking fatigue, depression, anxiety disorders, sleep disturbances are symptoms of inflammation, chronic pain, symptoms of inflammation in the brain. That now gives us an opportunity, as opposed to treating symptoms, to treat root causes and get people better.
Yeah, I mean, it's amazing to see this evolution of, and I was thinking about that earlier when you mentioned COVID, that there was sort of this legitimization in a lot of healthcare providers' minds of the concept of brain fog and difficulty concentrating. And it reminded me when it happened of, 10, 15 years ago, if you went to a gastroenterology physician and talked about intestinal permeability or small intestinal bacterial overgrowth or fungal overgrowth, they looked at you like you were crazy and that wasn't a real thing. And now the gut-brain connection's been well established, and you're going to get a much more sympathetic and curious healthcare provider who wants to help you get to the bottom of it now. It seems like we're just starting to cross that bridge with the neuroinflammatory conditions, and it's really exciting to see that happening.
And we have a whole specialty of gastroneuroinflammatory specialist.
Yep. Yeah.
Who knew?
Yeah, exactly. Didn't see that one coming, but it turns out we needed it. If people want to learn more about that conference or learn more about your work in general, where should they go?
They can go to the foundation website, so brainonfire.org. And so that's Foundation for Total Recovery. That's one of the sponsors of the program. medstarhealth.org/NDUCI 2023. is the other website that they can go on and register for the conference and learn about the conference and see the faculty. So, and you can actually, through our website, kaplanclinic.com, also be able to access some of that information. So.
Fantastic. Thank you so much, Gary. This was a blast and really appreciate your perspective, your expertise. I'll let you get on with the rest of your day, but thanks for coming and chatting with us. We really appreciate it.
I'm delighted to be here. Thank you so much for inviting me on the show. And as I said to you at the beginning of this, I'm very impressed with you guys are doing. You are legitimately pioneering with the new centers of healthcare are going to be looking at. You're talking about healthcare and not fixing people up and patching them, but really keeping them healthy. So bravo to you guys.
Really appreciate that. Thank you. That's all for this episode. Thanks everyone for listening. And if you're looking for more, be sure to follow us on social at WildHealthMD and head over to wildhealth.com or wildhealth.com/premium to become a patient and experience precision medicine for yourself.